Hi guys, welcome to Uncovering Client Needs using the VI-SPDAT. I'm Trudy Hernandez, a program specialist with Metro Dallas Homeless Alliance, and I'll be training on the VI-SPDAT version 2, which is the current version being used in our continuum of care for Dallas and Collin counties. These are the objectives that we will cover today. When you leave here, I hope that you have an understanding of what the VI-SPDAT is and why we use it, understanding the survey as a whole, and then of course how to conduct the survey for all subpopulations, including individuals, families, and youth. Please note that we will not be covering how to enter the information into HMIS. Please make sure that you watch the 2-minute video our HMIS team has kindly put together to understand entering the information into our HMIS system or client track. So jumping right in, you may have heard the term VI-SPDAT before and thought, what in the world does that even mean? Clearly, this is just an acronym, which means Vulnerability Index Service Prioritization Decision Assistance Tool. It's definitely a mouthful, right? I'm so glad that we're able to refer to it as the VI-SPDAT. It's much easier to say for myself. So the VI-SPDAT is a pre-screening tool or triage tool based on the full SPDAT and the vulnerability index. It takes a person or family's self-reports to confirm or deny the presence of more acute issues. Please remember, this is not an assessment, only a pre-screening tool, and should only be used as such. So I don't think we can really talk about the VI-SPDAT without talking a little bit about the full SPDAT, which came into fruition first. So the full SPDAT is a full assessment in which frontline staff are able to prioritize clients for housing and services. The goal of the full SPDAT is to improve housing stability outcomes. And the way that the full SPDAT came into being is the creator, who is also the founder of Org Code, decided he really wasn't happy with the way that housing programs were working. And what he was seeing is that decisions were being made based off of feelings rather than on data. And so he wanted to create something more concrete, a system for deciding who should be housed first and with what resources based on need. Rather than us just saying, oh, you know what, this person is going to be a really good candidate for my program, let's enroll them. We can actually look at, does this person really need the services that my program offers? So the way that the full SPDAT was created is kind of laid out here. So they compiled and researched and did a lot of analysis of 13 different intake and assessment tools. They then took those tools to focus groups with practitioners and persons with lived experience and got feedback on what the assessment should look like. They took that information to the expert advisory panel, did some more academic research, they tested it, they refined it, and came up with our final product. So one of the downsides of the full SPDAT is that it took so long to conduct. And so they decided they really wanted to create something that was shorter, that could be done in one small setting, but that would also give them that same basic information to start out with. So they started looking at another survey tool, which some of you guys may have heard of before, which is the Vulnerability Index. And what the Vulnerability Index is a short survey that's used to measure medical vulnerability or risk of morbidity. They took that and they looked at the components of the full SPDAT, which they know had all of the components that they really cared about and wanted to see. And so in 2013, they began merging those two tools into one, and that is the VI-SPDAT. Amendments have been made over the years since 2013 as they come up with new research and learn more about best practices. So what does the VI-SPDAT do? Simply, it objectively gathers information. It allows us to prioritize folks based on the data that we have rather than the opinions that we have on that person. We know that it is trauma informed and it allows the household story to follow them, and they don't have to answer these questions with each new worker that they meet. It helps us to improve case management, and what I mean by that is it allows us to look at time management and spending more time with individuals who have higher acuity and less time for those with lower acuity. It also allows for change over time, and we'll talk more about that later on. What the VI-SPDAT does not do, it does not make any claims of being perfect. We know that it's not a perfect tool, and we know that with each new set of research, we are able to make changes based on that. We know that it doesn't have a brain, and when I say that, what I mean is it can't say anything. One of the things that we hear a lot is, well, the VI-SPDAT says that this person is a better fit for rapid rehousing. That's not true. It does make recommendations based on scoring, but we know that with the information that we have outside of the tool, we might be able to make a better decision. It doesn't make any diagnosis. It's not any type of clinical assessment or clinical tool. So anyone who's using this should not use it as a tool to diagnose. It doesn't make decisions. That's basically what I was saying when I say it doesn't have a brain, is it doesn't make any final decisions. It allows us as the professionals working in the field to do a more in-depth assessment to make decisions that are best for the client. And then it doesn't take the place of those other clinical tools. So make sure that we're not replacing clinical tools that you guys are doing already and replacing it with this. This should be done in conjunction with any type of assessment. So why do we use the VI-SPDAT? In the most simple way of explaining, the reason we use it is to assist us in ending homelessness. We know that we have to function as a system in order to end homelessness. We have to be able to be objective when we determine services. It's very easy to put our own opinions into decision making, and this helps us to kind of step back and let data show us what needs to be done. It takes us away from this waiting list mentality that we often have to a priority list. So it's not first come, first serve. We're looking at who has the higher acuity, who is the most vulnerable in our community, to prioritize for housing over someone who might be able to self-resolve. And then we know that in order to end homelessness, we have to move away from the idea of who's eligible for my program to this is the person who needs the resource the most. So next we're going to talk about understanding the survey and kind of how it is built. So these are the components of the VI-SPDAT. When we look at the individual and youth VI-SPDAT, we have 4 components. That's history of housing, risks, socialization and daily functioning, and wellness. And then in addition to that, in our family VI-SPDAT, we have an extra component, which is the family unit. Within each of these components, you'll see the listing of what is included in that. So history of housing looks at both the history of housing and homelessness. Risks, we look at risk of harm to self or others, involvement in high risk and or exploitive situations, interaction with emergency services, managing tenancy, legal issues, socialization and daily functioning, looks at social relations and networks, personal administration and money management, meaningful daily activities, self-care and daily living skills. And I'll let you guys take some time to look at those components within wellness and family unit. All right. Hopefully you guys have had a chance to review those. So now we're going to go into conducting the survey, and this is the bulk of the training. And what I want you guys to focus on is understanding specifically the questions that we go over. How would you maybe reword or clarify for a client if they have questions on what something means? So as we go through, write down any questions that you might have. I will be sharing my contact information at the end. Please feel free to reach out and ask any questions. I know when we do video trainings, it makes it a little bit hard to get questions answered, but I want to make sure that you guys know that I will be available after this is completed. So how often should the VI-SPDAT be completed? In the ideal world, we only want to complete it one time. The VI-SPDAT is not meant to be done until you get the score that you want. We want to make sure that it is true and accurate to what the client is going through. Of course, there's always exceptions to rules, and so I've put the 2 exceptions here, which is basically if the person or family was housed and returned to homelessness, depending on the length of time, their vulnerability may have increased or decreased since the last time that they experienced homelessness. And then anytime a major life event occurred. And there's some examples there. Things to remember to do as you're doing the survey with clients. You want to make sure that you explain what the survey does. Encourage people to be honest, provide clarification when and if requested, and then always, always, always provide confidentiality while using the survey tool. We do ask some very personal questions that folks may not want to answer in a room full of people. Things to remember not to do. Please don't tell people that there is a number or refer to them as a number. Yes, we know that there is scoring related to the VI-SPDAT, but whenever we share that with our clients, it makes it feel like it's a test or something that they can get wrong. And we see whenever they know that there's a number attached that clients aren't as honest with their answers as they would be had they not known that. Never try to serve or case manage while doing the survey. And what I mean by that is make sure that when you're going through the survey that you are completing the survey in one sitting and you're asking those questions basically one after the other. You don't want to ask a question, hear the person's answer, and think to yourself, oh, I have a resource that this person could really use, and stop and kind of provide that information there. Make a mental note of it, and then at the end of the survey, you can say, hey, I remember when you answered this question, I have this resource for you. It's much better if we can get through the survey in one sitting so that we can make sure we have more accurate information. Don't ever promise anything as a result of the survey. We know that in our community, we do use the VI-SPDAT currently to help with prioritization to get into our rapid rehousing and permanent supportive housing programs. However, we cannot promise that by them completing this survey that they will get into housing. So make sure you're not promising anything like that as a result. Don't lead people to believe there's a waiting list. Don't change the wording or scoring. So the only time that you would want to change wording is if a client needed more clarification about what a question means in order to answer it. Don't complete it more than once, like we discussed before. Never complete a survey without informed consent or knowledge or in his or her absence. So you may have been working with a client for a while and feel like you know the answers to the questions. Make sure that you're not doing this. Make sure that you are actually talking to the client. This is a self-report survey, so whatever they tell you should be marked. And then going back to keeping confidentiality, make sure that when you're completing a survey that there's not multiple people in the room. unless they are also an HMIS end user, which means that they understand all of the privacy rules that you understand. So going into the survey takes about 7 minutes. So it's very important that you understand that this is short and you can do this in a small amount of time. You will see these boxes throughout as we go through. Keep in mind, this is basically like a paper copy, if you will, of what the VI-SPDAT looks like. Our community does enter this information into HMIS, and so a lot of this information here will be pre-populated for you, and you will not have to worry about that. So the opening script, this is something that you don't have to memorize verbatim, but it is important that you kind of get an idea of what you're going to say every time that you introduce the VI-SPDAT to a client. We know that when it comes to accuracy and fairness throughout communities, the opening script is a big way of making sure that it's accurate across the community. If I introduce it one way and someone else introduces it another way, we may not get the same types of responses from clients. So like I said, it doesn't have to be verbatim, but the things that you want to include are obviously, if they don't know who you are, introduce yourself, let them know who you work for. That's just good practice across the board. Let them know why the VI-SPDAT is being completed. And the way that I explain that is that it allows us to get a better understanding of their needs, and it helps us to determine how we can support them in the best way. Let them know that it only takes between 7 and 10 minutes to complete. A lot of times, whenever you talk about doing a survey, clients are going to not be so excited to do it if they think it's going to last forever. So it gives them a little bit of understanding of this is just a small survey that won't take too long. Let them know that most of the survey is just yes or no answers. They don't have to provide any additional information if they don't want to. And we actually encourage not to give too much information during the VI-SPDAT. Let them know that any question can be skipped or refused. So they do not have to, even if they agree to do the survey, if there's a question that makes them uncomfortable, they can say, I don't want to answer that. Let's move on. Let them know where the information is being stored. So like I said, it goes into HMIS. So hopefully by the time you're doing this, you have already explained to them what HMIS is. If not, take that time to kind of let them know that their information will be stored there. Also remind them that at any point, if they don't understand a question, that you can provide that clarification. They don't have to guess what you mean when you ask a question. And then just always remind them that it's important to relay accurate information, helping them understand that there's not a correct or preferred answer that they need to provide, nor is there any information that they need to conceal. And just letting them know the more honest you are about yourself, the better we'll be able to understand you and help you and provide the services that you need. All right, so we finally got to conducting the actual survey. So this basic information you see here, that will pre-populate for you in HMIS. But the reason I include it is you'll see these red boxes throughout, and this explains the scoring. HMIS is great because it will score it for you, but I want to make sure you have no questions about where that score comes from. So from just the very basic information, you're going to see that if a person is 60 years of age or older, they automatically get a score of 1 to go towards their final score. So this takes us into the first component, which is history of housing and homelessness. Question number 1 is just, where do you sleep most frequently? And you'll select what they say. So shelters, transitional housing, safe haven, or outdoors. And then if they say anything else, you can put that there and specify what they've said. Whenever we talk about safe haven here, we are talking about the safe havens that serve individuals with mental illness. They are specific to safe havens. If you are unsure about what that looks like in our community, please reach out and we can clarify for you. So based on question 1, if that person answers anything other than shelter, transitional housing, or safe haven, then they would score a 1. Question number 2 is, how long has it been since you lived in permanent stable housing? And you'll just fill that in. And in the last 3 years, how many times have you been homeless? So those 2 questions are looking at chronicity. If the person has experienced 1 or more consecutive years of homelessness and or 4 or more episodes of homelessness, then they would score a 1. This takes us into the second component, which is risks. So question number 4 is a multi-part question. So you're going to want to say, in the past 6 months, how many times have you for each one of these questions? For sake of time, I am not going to do that. One of the tips that we like to give for any question that has time related, we want to help the client understand in context, what does that look like? We know that individuals who are experiencing homelessness are oftentimes kind of in a crisis mode, and they may not even know what day it is, much less what day it was 6 months ago. So, for example, if I completed this assessment, this survey, in May, you would want to say in the past 6 months, meaning May, April, March, February, January, and December, how many times did these things happen? And so you may even have to go month by month. You may have to say, okay, last month, how many times did you receive healthcare at an emergency department room? And kind of go from that angle. You will have to kind of decipher what your client needs in the moment. So this is looking at receiving healthcare at an emergency department or room, taking an ambulance to the hospital. Have they been hospitalized as an inpatient? Have they used a crisis service? List all of those out. Make sure you do list each one of those out. E is looking at talking to the police for basically any reason. And question F is looking at, have they stayed at 1 or more nights in jail or prison? I do want to point out on F, this is an example of how those focus groups gave their input for the creation of the VI-SPDAT. So they included the short-term stay like the drunk tank. And the reason they did that is our people with lived experience that were part of that focus group said, we may not connect the dot that the drunk tank is what you're asking about. And a lot of people understand that a short-term stay in jail is talking about a drunk tank. So for question 4, if the total number of interactions equals 4 or more, then they would score a 1 for emergency service use. Question 5 and 6 are looking at risk of harm. So if they say yes to either one of these, they'll score a 1. Have you been attacked or beaten up since you've become homeless? And this question is looking at this episode of homelessness. So we're not asking if this person was homeless 6 years ago and they were housed and now they're homeless again. We're not asking about that episode 6 years ago. We're asking about that episode that they are currently in. And then, have you threatened to or tried to harm yourself or anyone else in the past year? After you get past risks, you can remind them that for now on, all you're seeking is yes or no responses to the questions. Question 7 is looking at legal issues. So do they have any legal stuff going on right now that may result in you being locked up, having to pay fines, or that make it more difficult to rent a place to live? On this, you want to make sure that it's very clear that this is strictly for the purposes of our survey and how we can serve them better in the future. Let them know that they will not, depending on their answer, we will not contact law enforcement unless, of course, they give information that makes us believe that they're a harm to themselves or others. Question 8 and 9 are risk of exploitation. For some reason, there's been a lot of folks who think that these questions are only for the female participants in their programs. Please note, unless it explicitly says for females only, you should be asking every question to every person. So does anybody force or trick you to do things that you do not want to do? Or do you ever do things that may be considered to be risky, like exchange sex for money, run drugs for someone, have unprotected sex with someone you don't know, share a needle, or anything like that? On question 9, it's very important to put emphasis on that last part of anything like that. Sometimes whenever our clients hear those examples listed out, they'll say, oh no, I definitely don't do any of that. But when you ask, okay, but do you ever do things that might be considered to be risky? Then they're like, well, yeah, of course I do. So make sure they understand that question when you're asking it. So the third component is socialization and daily functioning. Is there any person, past landlord, business, bookie, dealer, or government group like the IRS that thinks you owe them money? So this is anybody who you owe money to or thinks you owe them money. We know that there are some clients that we work with that would never admit that they owe money, but they will say, so-and-so thinks that I owe them this money, but I don't think so. So make sure you read that the way that it was written, because it was done intentionally. Question 11 is, do you get any money from the government, a pension, an inheritance, working under the table, a regular job, or anything like that? So any type of income is mentioned there. If they say yes to question 10 or no to question 11, then they would score 1. Question 12, do you have any planned activities other than just surviving that make you feel happy and fulfilled? This is a question that I often get asked for clarification. So some examples that I might give is, do you plan every week to go see a family member? Do you have family game night? Do you do anything that it's a plan? It has to be a planned activity that you know you're going to be doing, but that it brings happiness and joy to your life. If they say no to that, then they would score 1 for meaningful daily activity. 13 is looking at self-care. So if they say no to this, they would score a 1. This question says, are you currently able to take care of basic needs like bathing, changing clothes, using a restroom, getting food and clean water, and other things like that? So this question is not only looking at, are they able to do this, but do they have access? So make sure that it's not just that that they're able to take care of themselves, but like if someone is staying in a campsite and doesn't access services on a regular basis, how are they fulfilling these daily activities? If they don't have a place to get food and clean water, then that would take away their ability. Question 14, is your current homelessness in any way caused by a relationship that broke down, an unhealthy or abusive relationship, or because family or friends caused you to become evicted? They say yes to that, they would score 1 for social relationships. That takes us into the last component, which is wellness. Question 15, have you ever had to leave an apartment, shelter program, or other place you were staying because of your physical health? Do you have any chronic health issues with your liver, kidneys, stomach, lungs, or heart? Question 17, if there was a space available in a program that specifically assists people that live with HIV or AIDS, would that be of interest to you? That question is really looking at, does the person have HIV or AIDS? Question 18 is, do you have any physical disabilities that would limit the type of housing you could access or would make it hard to live independently because you'd need help? For this, I give the example of someone who is in a wheelchair might not be able to access housing that is on the second floor unless there's an elevator. Question 19, when you're sick or not feeling well, do you avoid getting help? And then question 20, this is the only question that specifies for female respondents only, and that's looking at, are they currently pregnant? If they say yes to any of those 15 through 20, then they would score a 1 for physical health. 21 and 22 is looking at substance use. So has your drinking or drug use led you to being kicked out of an apartment or program where you were staying in the past? Will drinking or drug use make it difficult for you to stay housed or afford your housing? 23 is looking at mental health issues. Have you ever had trouble in maintaining your housing or been kicked out of an apartment, shelter program, or other place you were staying because of, and this is a multi-part question as well, looking at mental health issues or concerns, a past head injury, and learning disability, developmental disability, or other impairment. And then 24, do you have any mental health or brain issues that would make it hard for you to live independently because you need help? So if they say yes to 23 or 24, then they would score a 1 for mental health. This extra red box that you'll see under mental health is related to trimorbidity. And our HMIS system will catch this for you, but just so that you understand how the scoring works is if the participant says scores a 1 for all 3 categories of health, then they will be considered trimorbid. So they have to have a score of 1 in physical health, substance use, and mental health. And if that's the case, then they will score an extra point for trimorbidity. This takes us to the end. So 25 and 26 are looking at medications. So are there any medications that a doctor said you should be taking that for whatever reason you are not taking? And 26, are there any medications like painkillers that you don't take the way the doctor prescribed or where you sell the medication? So if they say yes to either one of those questions, they would score a 1. And then 27 is our last question, and you'll see there in red, it reminds you to say yes or no. Has your current period of homelessness been caused by an experience of emotional, physical, psychological, sexual, or other type of abuse, or by any other trauma you have experienced? If they say yes to that, then they would score a 1. One thing that I'm not sure if I mentioned at the beginning is that we never want to change the order of the questions. We want to make sure that we ask these directly the way that they are listed in the survey. And the reason that we want to do that is because the way it's set up is to be trauma informed. So the first few questions are very, low impact. They're very basic questions just about kind of what their experience is as far as housing goes. And then this last question talks about abuse and trauma. So this allows us, if that question is asked and it brings up emotion and they are, rethinking about something that they've experienced, the survey's over and now you can case manage, you can take over that conversation and help the client process what they're thinking through. So this is how the scoring results break down. So for the individual survey, they can have a grand total of 17, and that is shown here. It's broken down in each section to see how many they can get. Next to that is the results recommendation. So like I said, this doesn't tell us what to do, but this is what the research showed is that people who scored 0 to 3, there's really no housing intervention needed. These are going to be the folks who have very low acuity, they're less vulnerable, and they more than likely will be able to self-resolve on their own. The folks who score between 4 and 7, we want to assess further for rapid rehousing. These are the folks who have some supports and they might be able to take over a rental subsidy after that subsidy is over. And then folks who score an 8 and up, those are the folks who are more vulnerable and that we should look at providing permanent supportive housing opportunities for. And then these follow-up questions, these are also in HMIS. These are not required. However, I always encourage people to ask them whenever they are able to. So this is looking at where it's easiest to find the person and what time of day is easiest to do so. Is there a phone number or an email or anything like that that people can reach you at? The picture, not so much, but we really want to make sure that if these folks are being referred for housing, that we have a way of finding them and being able to connect to them. So this takes us into the VI-SPDAT for families. Don't worry, I'm not going through the entire survey with you guys. I am only going through the differences that we see. So for families, we say the survey takes approximately 9 minutes, so just a few more minutes extra than our individual. Same basic information, which will be pre-populated for you in HMIS. If it's a 2-parent household, that will also be added. So if either head of household is 60 years of age or older, then they would score a 1. The children section asks several questions. So question 1 is, how many children under the age of 18 are currently with you? So this is, if they're staying in a shelter, these are the children who are staying in that shelter with the family. Question 2 is, how many children under the age of 18 are not currently with your family, but you have reason to believe they will be joining you when you get housed? So this might be a mom and dad who's staying at a shelter, but their kids were able to go stay with grandma until they're able to get back on their feet. We want to make sure that we account for any children who will be living with them once they are in housing. Question 3, if the household includes a female, then you're going to ask, is any member of the family currently pregnant? And question 4 is just listing out the children's names and ages. And then you'll see the scoring broken down. So if there's a single parent with 2 or more children and or a child aged 11 or younger and or a current pregnancy, then score 1 for family size. If there are 2 parents with 3 or more children and or there's a child aged 6 or younger and or a current pregnancy, they would score a 1. The family survey is definitely the one that I'm so thankful for our HMIS system being able to calculate for us, because the scoring does get a little bit tricky. So the first component, history of housing and homelessness, this is all the same. So I'm not going to go through this. What I want to point out is that when we're looking at a family system and providing this survey, we want to make sure that we're asking about the most vulnerable person in that family. So whenever we say, where do you and your family sleep most frequently? Let's say that mom and kids are staying in a shelter, but dad is staying outdoors somewhere. For that question, we're going to take the most vulnerable person, which is dad, and select outdoors. Same thing throughout. So when we look at risks, in the past 6 months, how many times have you or anyone in your family received health care at an emergency department or room? This is the most vulnerable. So maybe in this case, mom had to go to the emergency room and no one else has any interaction with emergency services. We would go ahead and put that mom had 1 emergency department or room experience. Wellness is all the same. The one thing I do want to point out is that, and this will be a little bit on your end, unfortunately, our HMIS system won't be able to tell exactly how the answers are being asked on this. So in order to be a trimorbid family, it has to be 1 single member of the household that has the medical conditions. So, for example, if we had mom who had a mental health diagnosis, dad who had a substance use diagnosis, and a child with physical health diagnosis, that family would not be trimorbid. However, if we had mom who had all 3, mom had a physical, mental, and substance use disorder, then that family would be considered trimorbid. I know that can get pretty confusing, so please reach out if you have questions on that. And that takes us into the component that's different, so family units. So I will go through these questions. Question 32, are there any children that have been removed from the family by Child Protective Service within the last 180 days? 33, do you have any family legal issues that are being resolved in court or need to be resolved in court that would impact your housing or who may live within your housing? If they say yes to either one of those, they would score a 1 for family legal issues. You'll see 180 days listed a lot in the family section. The reason that they selected 180 days is that is the number and the way that Child Protective Services usually works, and that's kind of the common denominator for a lot of these questions. So question 34, in the last 180 days, have any children lived with family or friends because of your homeless or housing situation? So this might be that situation I talked about earlier where mom and dad are staying in the shelter, but their kids were able to go stay with another family member. So what we want to decipher here is 32 and 33 is looking at involuntary removal of kids. And then question 34 is looking at a voluntary. We allowed our children to go stay somewhere to stay away from the shelter. Question 35, has any child in the family experienced abuse or trauma in the last 180 days? 36, you'll only ask this question if they have school-aged children. So do your children attend school more often than not each week? As I'm recording this, we are still going through our COVID-19 pandemic. So a lot of questions are raised there. So obviously if they are not able to be at school for any particular reason, if they are doing online school, you want to make sure, are they attending their online school more times than not each week? If it's during the summer, you're going to ask, when school is in session, are your kids going to school more often than not? Just to clarify, the way that we kind of look at that is, are they attending 3 out of 5 days? If they say yes to questions 34 or 35, or no to question 36, then they would score a 1 for needs of children. 37, have the members of your family changed in the last 180 days due to things like divorce, your kids coming back to live with you, someone leaving for military service or incarceration, a relative moving in, or anything like that? So that's really looking at, did the composition of the family change at any point? And then 38, do you anticipate any other adults or children coming to live with you within the first 180 days of being housed? So if they say yes, they would score a 1 for family stability. 39, do you have 2 or more planned activities each week as a family, such as outings to the park, going to the library, visiting other family, watching a family movie, or anything like that? Question 40, after school or on weekends or days when there isn't school, is the total time children spend each day where there is no interaction with you or another responsible adult? There's 2 parts of that. So 3 or more hours per day for children aged 13 or older, or 2 or more hours per day for children aged 12 or younger. Obviously, if they don't have children who are 13 or older or 12 or younger, you would not ask that question. And then question 41 is if they both have children 12 and under and 13 and over. And that's asking, do your older kids spend 2 or more hours on a typical day helping their younger siblings with things like getting ready for school, helping with homework, making them dinner, bathing them, or anything like that? So if they say no to question 39 or yes to any of the questions 40 or 41, they would score a 1 for parental engagement. And that is the end of the family VI-SPDAT. And this is the scoring summary for that one. So we saw in the individual VI-SPDAT, they could score up to 17. For families, it's up to 22. It's the same result recommendation. So 0 to 3, we're looking at no housing intervention, 4 to 8, an assessment for rapid, and 9 and up for PSH. So one thing that we like to remind people is that it is actually very rare for a family to score in the level for PSH. a lot of times we will tend to second guess those results and want to make changes. Please don't do that. Never change the results of what you find based on what you feel. Trust that this is looking at and scoring the most appropriately. That takes us to the last one. We are almost done. So the VI-SPDAT for youth, that is looking for youth who are under the age of 24. So that's 18 to 24, the way that we typically see youth in the housing and homeless definition. So 18 to 24, you will conduct this one. There's just a few changes from the individual in this, and we'll go through that pretty quickly. So in question 1, they have added couch surfing. And most of the changes that have happened for the youth survey is based on the research that they saw and what made those youth between those ages more vulnerable and more likely to either become homeless or remain homeless once they started that experience. Question 8 is, were you ever incarcerated when younger than the age of 18? Question, I believe this is 15. I covered up the number. I'm pretty sure it's 15. Is your current lack of stable housing because of any of these reasons? And so these are looking at social relationships and abuse and trauma. These are the most common reasons why persons between 18 and 24 have identified as being the cause of their homelessness. I'm not going to read through each one of those, but I'll leave this up for a couple more seconds so you can look through those. All right, so that takes us into wellness and question 21. So rather than just asking the female respondents, this question is changed to ask about pregnancy in a different way. So it says, are you currently pregnant? Have you ever been pregnant, or have you ever gotten someone pregnant? 24, this question is different from our individual, and it's asking if you've ever used marijuana. Did you ever try it at age 12 or younger? And the scoring summary is worded differently, but it means the same. So 0 to 3 is no moderate or high intensity services. 4 to 7 is assessment for time-limited supports with moderate intensity, which we know as rapid rehousing. And then 8 and up is an assessment for long-term housing with high service intensity, which is what we often refer to as permanent supportive housing. That brings us to the end. That's all I have for you guys today. Thank you for hanging in there. I know this isn't the most exciting training, but it is a needed one. And like I said, I really want you guys to think about if a client had questions about clarifying something that you ask, would you be able to do that? If you aren't sure about something, make sure you reach out so that we can talk through that and you have a game plan for whenever you do start conducting these surveys and you're prepared to answer a question that a client might bring up. Please make sure that you complete the sign-in sheet and evaluation for this training so we can make sure that you get credit for watching this video. My information is here. Like I said, my name is Trudy Hernandez, and I'm the program specialist with Metro Dallas Homeless Alliance. I do have my email address there. That is the best way to stay in contact with me, so feel free to reach out at any point. One last reminder to watch the 2-minute video on entering the VI-SPDAT into HMIS, and then make sure that you are completing that sign-in sheet and evaluation so that we can make sure you get credit. Otherwise, I hope you all have a really great rest of your day,